The chapter on physical therapy for neuromuscular conditions does, I think, a very good job of taking some very complex health conditions and making them accessible in terms of mini vignettes regarding progressive and non-progressive neuromuscular health conditions. So I would reference you back to the objectives of what the chapter is asking, and I do mirror those objectives in the lesson builder as well, although I do expand on them a little bit. I would kind of just quickly go through the introduction, but you don't need to memorize any of that, certainly. I do want you to learn about the basic definition of a stroke, and knowing that there's two different types of strokes. There's an ischemic type of stroke, decreased oxygen, or it may be caused by a blood vessel burst, is what we call hemorrhagic stroke. That is more rare. Most strokes are ischemic strokes. So, what else do I want you to know about the health condition strokes? I do think that it's important to know that that most return happens the first 3 months. I do think that's very important to know, and that there are some long-term health problems that accompany a stroke, such as isolation and depression. That is mentioned earlier in this section. Moving on to traumatic brain injury, this kind of ties into the discussion on concussions as well. So know kind of the age category that is affected by traumatic brain injury. The falls, especially in older adults, are one of the leading causes of traumatic brain injuries. So it's not just a problem among younger people, but also people that have more life experience, and that there are other conditions that accompany having traumatic brain injury, such as the emotional component, similar to the event of a stroke. Now, these are both non-progressive problems. People don't get worse. People may have successive strokes, for example, but and certainly people could have more than one traumatic brain injury if they have multiple falls. So then spinal cord injuries. This is complex. This is another non-progressive problem, meaning it doesn't get worse. There certainly can be improvements in health conditions with people who have spinal cord injuries, but there isn't a progressive nature to a spinal cord injury. I do want you to know what it is, that there is damage to the spinal cord or nerve roots, and the risk factors and who is mostly affected. It is men, and young men particularly. However, we're seeing more older adults having spinal cord injuries. I do want you to know the basic definition of tetraplegia, and then paraplegia. I think you have some, just some good images of physical therapy interventions for someone with a spinal cord injury. Next, I do want you to know this. I'm really glad you added this section. It wasn't in the earlier edition of vestibular problems. The basic definition of what vertigo is. I really want you to know that dizziness is not normal. That is not a process that occurs with aging. I think it's very important to know that dizziness is not normal. And I do want you to know this peripheral vestibular problem called BPPV, or benign paroxysmal positional vertigo. And you may have heard of this problem, but it's something you do need to become familiar with. MS is another one of those health conditions that you probably have heard of. I do want you to know the basics of what MS is. And I think this is, very important to have a basic definition of MS. I'm not asking you to do additional research and become experts in MS, but particularly know, what it is, and that there's different types of MS. There's some that are more rapidly progressive, which is a small section of people with MS, but the periods of exacerbation and remission is much more common. And we'll learn a lot more about MS next year in 204 as well as 103 this winter. And then a basic definition of Parkinson's disease. Know what rigidity is, and bradykinesia, tremor. These highlighted words are important to know. Guillain-Barré syndrome, just the basic definition, is fairly rare. It is something that is considered progressive. However, people often make a full recovery with Guillain-Barré. And then basically ALS as well. You may have heard of the book Tuesdays with Morrie. This is something that causes a rather rapid decline in the outlook with ALS is very poor in terms of the fact that there is no really good treatments. So I don't want you to split hairs on all the history and examination. I think that's beyond what I want you to know. So you can kind of skip ahead and pass up the history, the systems review. I'm not minimizing the importance of this area, but I think for study's sake right now, I want you to just sandwich it down a bit. I do think it's good to know what high tone is and low tone, the definitions. Hypertonia is excessive tone, whereas hypotonia is low tone. Get familiar with those terms, and also spasticity, which is a velocity-dependent hypertonia, so it's high tone. A basic definition of sensation and perception. But I don't really want you to spend too much time on this. I think it's something you'll learn more in winter term and also next year. But I think what's important to know about sensation is what we're receiving from our senses, whether it's hearing, whether it's vision, whether it's touch, and certainly taste. And that perception is the ability to integrate sensory information and interpret it in a meaningful way. It's a cognitive function, and that's important as far as the difference. Evaluation, diagnosis, you can skip ahead on that. Principles of intervention, you can take a brief look at that. I do want you to know basic motor control. That is something that you have been exposed to a little bit in lab already, and some of the work in 101. So I think it's important to know the basic definition of motor control. I think neurospasticity is a nice basic term of how different parts of the brains will accommodate parts of the brain or spinal cord that are injured. And then we have a term of motor learning, which is the process of learning new things at that cognitive level in terms of practice and repeated practice. After a lot of practice, there's motor control. I think CIMT is a basic term I want you to know. And then finally, I think that's it for that section.